colleagues are doing a lot of heavy lifting through this pandemic. We've got Minister Caroline Mulroney, Minister Doug Downey, and Minister Jill Dunlop. We are surrounded by quite the team. And of course, we've got Norm Miller from MPP from Barrie Sound, Muskoka. And so all of us have been very diligently working with Dr. Gardner, who's joining us here today. We meet quite often just to get a lot of your questions answered and try to relay them to you as quickly as we can. We thought today would be great to also have our bylaw team join us. They've, of course, have been working in stride this whole pandemic. We've got bylaw from Bradford East School in Barrie with Brett Lee. We also have Barry Vickers with us from the town of Innisfil. We have Stephen Rabello with us from Simcoe, Muskoka, and we have Jason Forgrave from the city of Barrie. And of course, we've got others who are working with us in our offices who are with us on the call today as well. So thank you again for joining us. With those introductions, I did want to lay out the agenda for the day. We're here to run through examples and questions that you may have. So I'm going to pass it on to Minister Downey, who's going to explain sort of the process around how cabinet decisions are made around the health table.
Thanks, Andrea. And I think if it's okay with you, maybe we can have each of the members and people sort of introduce themselves because they may jump in to correct me as I say things.
Absolutely. So, go over to introductions.
Yeah. So we'll start, why don't we go in the order of Caroline, Jill, and Norm, and then we'll turn to the others.
Well, thanks, Doug, and thanks, Andrea. Thank you to everyone who's joining us today to discuss COVID-19 related issues in our communities. You know, since the beginning of the pandemic, you need to know that our government's actions have been informed by public health advice every step of the way, as well as continuous engagement with the people in our communities. Business owners in Simcoe County and across Ontario are doing their part to follow public health advice and save lives. And helping our small businesses to keep their customers and their employees safe is also a key part of building consumer confidence and safeguarding the health and communities across Ontario. I know that I'm looking forward to hearing from Dr. Gardner today and his team, as well as from our local bylaw officers. These organizations are the ones that have been working diligently throughout the pandemic to keep us safe and healthy. And I wanted to express my sincerest appreciation to them for all of their work. Thank you again, and I look forward to today's conversation.
So I'll jump in now. It's my pleasure to join you all here today, along with the other MPPs from across Simcoe County. I'm Jill Dunlop. I'm the MPP for Simcoe North. We are privileged to have Dr. Gardner from the Simcoe Muskoka District Health Unit and members of our bylaw community join us today to help provide information and clarity to the communities of Simcoe Muskoka. We know you will find this town hall to be helpful in defining the roles and responsibilities of levels of government specific to COVID-19 protocols, regulations, interpretations, inquiries, and enforcement. There are two things that I feel hold true today. There is strength in numbers, and communication is key. We have a full registration and valuable insight from a professional panel, and we look forward to sharing necessary knowledge with you today. And I'll pass it over to Norm.
Thank you, Jill. I'm Norm Miller, MPP for Parry Sound Muskoka, and I would just like to thank Doug Downey and his team for organizing this with the Barrie Chamber of Commerce. And I'd also like to thank Dr. Gardner for his ongoing work, but also the job he's done of reaching out to us as MPPs on a weekly basis and keeping us informed and answering questions and doing a great job. So I wanted to thank you, Dr. Gardner. And, you know, I think in our last meeting, I had some questions about the blitz that was of inspections that went out and some complaints from some of my businesses that I raised with you, and you promptly answered. So I appreciate that you've been so responsive and look forward to what we will learn today in this session. So thank you for allowing me to participate.
So again, Andrea, if it's okay, maybe we'll just have, we have a number of bylaw on Sean, Crawford, and others. Maybe if you guys could just maybe introduce yourself and where you're situated so people can put a face to a name. That'd be great.
Hi, everyone. My name is Sean Crawford. I'm the manager of legislative services for the city of Orillia. So part of my role with the city is to manage the bylaw enforcement staff. And, I'd like to take this opportunity to actually just say a special thanks to the Aurelia businesses. They have been very highly compliant through this process, and they continue to reach out to get clarification of the rules, and we certainly thank you for that.
Maybe we'll turn to you next, Jason, if that's okay. Just to.
Yeah, thank you, Attorney General Downey. Jason Foregrave, Supervisor of Enforcement Services for the City of Barrie. We've been doing the COVID enforcement for our center since, well, middle of March last year, so almost a year now. And to echo Sean Crawford, we found the Barrie businesses through our recent inspections and blitzes to be close to 70% compliant with rules and regs. We've been doing inspections since the recent lockdown started, or the past lockdown started on Boxing Day, and then had a blitz with the health unit and the Ministry of Labor recently. Found out that things were not too bad.
Great, maybe Barry Vickers.
I'm with the town of Innisfil, manager of the bylaw department there, and our team of 7 has participated in the blitz recently too, and it was a really great experience actually, going door to door and meeting people and sharing everybody's concerns and making sure that everybody was on the track to compliance. And we found a significant degree of cooperation and goodwill within the community. Everybody seems to be pulling in the same direction, and it was a really good intergovernmental operation that we all got to participate in. The health unit too was really, really significant with us, as well as the Ministry of Labor and South Simcoe Police, and worked with Brent in Bradford. It was pretty effective.
That's great. Maybe Brent, you can introduce yourself.
Good afternoon, everyone. Thanks for having me as part of the panel today. So manager of enforcement at the town of Bradford, we have a small team of about less than 10 officers and administrative staff. And just echoing some of the comments from my colleagues here, we were extremely pleased with how we were received by local businesses and encouraged that the efforts that businesses are trying to put forward to comply with regulations. There may have been some issues here and there that have to be sought through, but on general and en masse, at least in Bradford, we were extremely encouraged by those efforts and those partnerships that we're trying to establish and keep moving forward into the future. So thank you.
Okay, and I see some other, I know Renee's with the Township of Springwater.
Thanks, Doug. Renee Ainsworth. I'm the clerk for the Township of Springwater. As part of my role, I also oversee the bylaw enforcement department. With me today on the call is Brittany Kellington, who is one of our municipal law enforcement officers. And again, just echoing what everybody else has said, the residents and businesses in Springwater have done great through the pandemic. They have come to us with questions that they may have, and working with the health unit to get any of their inquiries dealt with has been extremely helpful. So thank you.
Right, maybe I'll turn to Jim. I see Jim Reicheld there.
Thank you. Just Jim Reicheld from the town of Midland. I'm the municipal law enforcement officer and compliance officer for COVID related items in our municipality within our walls. I was part of the blitz a couple of weeks ago, and I'll echo everybody else. It went very well. We were well received, even coming into a small mom and pop shop as a team, which can be intimidating, but it went very well with everyone working together and providing that education. So I was very pleased with the outcome of that, and thank you for having me.
And the last one, I'm not sure, Jordan, or if Jordan's with one of our offices.
Yes, thank you. Jordan E. Terry here, Township of Oro-Medon, today sandwiched in between Barrie and Aurelia. Very grateful to be a part of the panel today and join you. We've really relied heavily on the health unit, and the communication with them has been fantastic. So we appreciate the partnership with the health unit and moving forward.
That's great. And so why don't we finish the introductions just so Dr. Gardner can introduce himself and his colleague as well.
Thank you very much, Minister Downey. And I would like to introduce Dr. Steve Revellato, who is the VP for Environmental Health with the Simcoe Muskoka District Health Unit. I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit. And certainly this has been really quite the experience for us all, responding to the pandemic of the century. It has taken a whole of community approach, all levels of government, all sectors. It's been quite the marathon. Maybe we're halfway over, touching wood now, but it's really taken everybody pulling together, including very much businesses and the private sector. All the way along, we've played a role of advice and we do some enforcement, but overall it's advisory and support, and that has generally worked very well.
That's great. And so, and thanks again to the Chamber for doing this. So I'm going to jump into some perspectives. The thought that we had in putting this together was to arm people with information on how the system works or how it is working, and how you can access the system. So we won't necessarily, we're not going to take live examples because we have many examples of how we've problem solved and worked with people to keep people safe. I should mention that Jim Wilson, MPP Jim Wilson, was going to join us but had to send regrets at the last minute. So we have all of Simcoe and of course Muskoka covered. So from the provincial side, and any of my colleagues can jump in as well, I just want to talk about some of the different entities that exist in terms of decision making. So the front line are our constituency offices, and all of our constituency offices continue to function both by email, by phone, depending on where we are in lockdown, whether we will do in-person meetings or not, by appointment. But people are all of our staff are still working, quite frankly, working long hours to make sure that we're keeping up with inquiries and helping to guide people through these ever-changing times. So that's the first point of contact. If somebody has a question about it, they can certainly contact our office. So then what happens? When you contact our office, one of the first things we do is we reach out to the health department, we reach out to the public health unit, which you'll see that connection in a few moments as we talk about how issues get dealt with. But it doesn't hurt to reach out to us. It doesn't mean that we have the answer readily at our fingertips, because the rules change and things are evolving, and we will certainly be able to find answers in many cases. The other thing that we can do is we can identify programs that may fit if you're running a business or you're in a situation, whether it be childcare or otherwise. Those are things that our offices they get materials every single day on rules and regulations and decisions that are made, so that we can help guide you through that. And we understand there is a ton of stuff to go through. We want to help. Any one of our offices wants to help work through that. Sometimes we get a situation that we don't have the answer to, and we can't get an answer because one hasn't been given in coordination with our other partners. So what happens? Where does that information go? There are a couple of provincial level organizations. You hear about the health table. There is a health table with experts across many different fields, and they wrestle with what the best decision is to keep people safe. They connect with other committees, whether it be an essential business committee, which some of us from cabinet sit on, or cabinet itself, which makes decisions and coordinates with that health table. So there are active discussions there. If we're aware of the issue, because you've contacted our staff, that arms us to do follow-up, to be able to find out details about things. And I'm going to give an example. When back last spring, we were talking about allowing marinas to prepare boats. Well, not everybody knows what happens in a marina when you prepare boats. Some people think that it takes a bunch of people who are all working side by side, when in fact, it's really one and maximum two people in a field, in a yard, taking plastic off and working on a motor one at a time. So being able to give the real life, what happens on the ground, is helpful to us to draw that out from you. And we can get the responsible decision faster. Part of that discussion, and again, you'll hear Dr. Gardner's leadership role in that, in terms of talking to the health table on the other side. So they reach out to the local public health unit to have that discussion. So now we're talking about layers. And I wish it was simpler. I wish it was one level, and I wish it was one point of contact, but these issues are complex. And so it helps to have us coordinated. And Minister Dunlop set up a session where we meet with Dr. Gardner on a regular basis to be able to raise issues that you raise with us. So that's another place that you can reach out. If you're in a particular sector, and I'm going to pick on Minister McLeod, whose culture and tourism and sport, we worked through skiing issues. She was able with her ministry to engage with the health table directly to talk about what would make sense and see if there is a solution to the challenge. And they, of course, in turn work with Dr. Gardner. So again, multi-levels, multi-conversations. We can certainly advocate for specific areas once we understand them. It doesn't mean we can make them happen. We are taking the leadership, we're taking the advice from the health units and from the health table. But we can still articulate and put forward our best foot forward in terms of what your individual or business position might be. So I'm going to stop there for a second because I do want to leave time for others to be able to talk. I don't know if any of my colleagues want to jump in and talk about if there's any other areas that I'm not covering in terms of how we either do intake or help deal with issues.
Doug, I'll just add with respect to the example you gave about marinas. I think it's a great example because we heard a lot from our constituents around the lake on the issue of marinas, but across the province, there were other issues, other businesses or sectors that felt like some of the public health restrictions did not properly understand their business and how it functioned. And that's where the role of the constituency office and the intake that we do matters so much. And so I just wanted to point out that there's an example of politicians taking in information from members of their community and then that information being fed up to the cabinet table and really changing the outcome for a number of businesses. From my case, I dealt a lot with the greenhouses. That was a major issue in Bradford. And so, you know, those are it's an opportunity to showcase the fact that your voices are heard, and calling your constituency office and your local members does have an impact. And so I just actually want to thank all the people from Bradford who did reach out to my office on a couple of files because I was able to inform our conversation at the cabinet table.
And if I can jump in here, Mr. Downey, just to add to what Mr. Mulrooney was saying is, you know, we had during the Christmas holidays, I know a lot of dog grooming businesses, for example, you know, like we talk about health and safety for humans, but, you know, health and safety for man's best friend and women's best friend with pet grooming. And so being able to sort of navigate the answers on that, obviously, if you had a kennel, you could have continued to operate, but it was the grooming service where it had to be limited for, again, health and safety. But talking to a lot of the dog groomers locally and through the community, obviously you saw the minister as the Solicitor General did make some tweaks to that regulation. And then now that we're in red zone, of course, that's much easier for our pets. But that was, you know, that as a prime example too, again, going back and forth with public health in terms of, you know, what like the regs and how they were drafted. But that was just another example of ways we could work with you. And of course, with Paul Markle here and small businesses, it's the capacity thing, right? So for, you know, public health said they didn't want people going to multiple locations because it could spread the virus. So how do we come up with making sure it's safe, but also at the same time there's the economic consequences? And so now we're at the point where, you know, if you're in gray, you can still have a certain percentage of those small retail stores be able to open. So it's not just the big box stores, but that wouldn't have been possible without all the input either the chamber made and a lot of small businesses locally too.
I was also just going to add, you know, we spoke about our connection with the constituents, but I think it's also been valuable with bylaws. I know sometimes there's the gray areas and how are things interpreted. So we've been able to work with our local bylaw officers to then connect with either the health table or a Solicitor General to get answers on some of those questions too. And thank you to all the chambers. I know you've been fantastic in having us as well as other levels of government come to the table to get the information out to business owners too on the supports that have been available. So thank you for all your hard work.
Thank you everybody for that. And I don't know, Norm, if you want to say anything, or if I'll just hesitate for a moment.
No, I think they covered it fairly well. We certainly dealt with all the changing conditions. Marinas, I mean, I've got a ton of marinas in my riding. I know we had a Zoom meeting with, I think, 21 marinas at one point as we were dealing with issues, golf courses, all the changing conditions, as this is fluid since March, has been something our office has worked with a lot. Thanks.
That's great. So I'm going to go to the second part of the program, which so there are two more parts of the program. One is to hear from Dr. Gardner and Dr. Revelado in terms of I gave you a promotion, maybe, Stephen. I don't know if you're a doctor or if you're just VP, but the important work that they do. And then we'll hear from the bylaw officers on the enforcement side and some of the ways that they need to operate and resources they have and that sort of thing. But I want to start off with Dr. Gardner and say he's really wearing three hats all the time. He's not only dealing with the intake from our side, he's dealing with a health table at the central, and now he's also in charge of the rollout on the vaccine. Which I have to say, Simcoe Muskoka is in a leadership role on that across the province. So congratulations on that, Dr. Gardner, and that good work. I'll turn it over to you to let the viewers have some insight into what you do and how you do it.
Thank you very much, Minister Downey, and I do appreciate the positive acknowledgement. So this has really been a greatly challenging experience in public health, the event of the century, the way I characterize it. And it's also been quite the marathon. It's a very complex undertaking for us as an agency. Normally, our mandate is to promote the health of the population as a whole, to pursue ways of preventing disease in the first place. And those ways extend well beyond healthcare. They involve healthcare, but they also extend out into the way businesses operate, the way services are provided in the community. And it also includes surveillance, us monitoring how we're doing as a society, how we're doing in our communities about health, tracking with data what's happening. And so with the pandemic, all of that comes forward for us to carry out. We receive reports of all of the cases, and we, through that means, know that we have 6,000 plus cases that have occurred here since the beginning of the pandemic. We know that over 1,000 of those are related to work environments. We investigate them. We contact the individuals who are diagnosed as having cases and follow up with their contacts in order to put them into quarantine to avoid further spread. So that's a means of reducing transmission, a means of preventing disease in the first place. With our data, we can do analysis about what the underlying issues are for transmission. So we're able to identify where the failings may be that occur that allow for transmission in households, the fact that we're seeing a lot happening in households, how much of it we're seeing in the work environment. We're able to, by that means, know that we've had 1,000 plus cases that have occurred in the work environment, and able to identify what it is about the work environment that's led to transmission. For example, what we've seen is people interacting at times in the lunchroom or carpooling to work, or perhaps lapses in screening for symptoms, the necessity for wearing face masks. Early in the pandemic, we brought to bear the evidence that was emerging about what was needed to prevent spread in the community. And so the identification of mask use was something that we pioneered and promoted, working locally, working with the province, many of us issuing letters of direction. So myself, I had issued such a letter of instruction in order to really get the use of masks in place for the public as a way of reducing transmission. Looking at the evidence about distancing and the requirement for physical distancing, bringing all that forward as a form of messages through public communication so that people become aware of what we learn and when necessary, what we require of people or require of businesses in order to flatten the curve and blunt the transmission. And then now we have a new tool at our disposal, and that's immunization, vaccination. And that is something, of course, that we all have great hope for. I've seen tremendous interest in making that available to people. We have to work with municipalities and with the healthcare system in order to set up clinics so that we can provide it. We work with the province and the guidance that they provide us as to what order of operations we need to follow, whose priority to receive it first, since we do not have enough to give it to everybody all at once. And of course, we respond to outbreaks as well. So they are reported to us by law, but that means we become aware of the outbreaks that have been happening in long-term care facilities, and we provide our guidance and direction and bring to the table when necessary other providers, other agencies, other sectors, hospitals that we can bring to the table in order to provide direction of facilities when necessary and issuing orders when necessary for that to happen so that the outbreaks that we've had are properly managed. So very complex undertakings. All of it requires a lot of communication and a lot of partnership. So I find myself at many tables, and Minister Downey has cited something of that. I certainly have found it to be a privilege to participate on the provincial public health measures table, where over the months we've looked at the evidence of what's needed to flatten the curve and keep this under control, and have made our advice to government, to cabinet for their consideration. But also locally, we've established partnerships in order to really get the message out and coordinate our actions. So I meet on a regular basis with our MPPs, and that's been very helpful for me to get from them their needs and their perspectives, and for me to be able to communicate the status of things here. But I also meet on a weekly basis with the CAOs for the municipalities. And so that's a direct connection with all of our municipal councils in order to be able to coordinate action with the municipal sector as well. And when it comes to the public, we take calls from the public through our Health Connection line. We take emails. We have a means on our website for people to make submissions. We have a team that responds to those calls, those emails, those submissions. Often they're brought to my attention. They're always brought to the attention of people with expertise in order to respond. And through that means, we're able to provide guidance to our businesses and to the municipal sector and to the public sector about the latest requirements that have come, the latest direction from government, the latest regulations that have been put in place. And certainly that has been very much a changing target for us over time as we've learned more and as the situation has unfolded. We've seen very nimble government in this and putting forward legislative change. So one of our roles is to enforce on that and to inform on all of that. And we do so with two-way communication, calls from the public, our use of the media, and the use of social media as well. I have no doubt they will continue to need this kind of collaborative approach, very broad approach, and very much a partnership approach as we continue to navigate through this pandemic together. Perhaps if it's okay, Minister Downey, I could invite Dr. Rebellato to speak briefly as well. His role as VP for Environmental Health is very much aligned with much of what I've spoken to: interpretation of legislation, enforcement, and provision of guidance to members of the community with regards to legislative requirements.
Thank you very much, Dr. Gardner. I will be brief. I will echo your sentiments in thanking certainly the MPPs for hosting this call today and for the collaboration of our municipalities and the ongoing efforts of our business community. Certainly, ongoing vigilance is needed to prevent outbreaks in workplaces and to avoid a third wave in Simcoe Muskoka, in particular with the variants of concern that have been well communicated, I think, in the media and by experts such as yourselves on the call, and certainly Dr. Gardner. So I consistently refer members of the public and our businesses to our Simcoe Muskoka District Health Unit website, smdhu.org, looking at pages such as Operating Your Business Safely, which provides not only links towards our own content, but with the thanks of our provincial government. In addition to that, sector-specific guidance that Attorney General Downey has referred to, that is such an important part of our ongoing communications with our businesses. Thank you, Dr. Gardner.
Dr. Rebellato.
Well, thank you both. And I just wanted to, this is a good opportunity to raise, when Dr. Bellato talks about, large workplaces and how that could be a place where, we could have, God forbid, an outbreak. But this is one of the reasons that our Premier, Doug Ford, has constantly been advocating for the rapid testing and testing everywhere. We've been talking about this since day one of the pandemic, trying to get as many rapid tests to all of our different public health units. We now have that happening in our schools, and certainly working diligently to get more in our area specifically. But if you are a large business or company and you want to get your hands on rapid testing, the Premier did say you can reach out and call. There is a contact. It's a manager who does enterprise coordination. So I will make sure that we do include her contact info, but do reach out to any of our offices for the contact. But the coordinator is Andrea Salvati, so has the same name as me, so easy to remember, Salvati, and her email is andrea.salvati@ontario.ca. Again, do reach out to our offices if you need the contact info. But essentially what this does is, we want to, now that we have more rapid testing in our long-term care homes, to make sure that we don't have the outbreaks. And if we do, Dr. Gardner and his team and all our local hospitals are very diligent and helping us with that. And we've seen that work locally in many of our homes. But we also understand that there's companies where they have over 160 employees. And so in order to make sure that they're safe, we have this rapid testing ability available. So do reach out to us if that is something that you need. And I'll pass it over to you.
I want to add in that from the Ontario Chamber of Commerce standpoint, they've created an Ontario Vaccine Support Council that is made up of currently 150 members from the private sector, large businesses, many of them with international experience and success, with vaccine rollout, that kind of thing, but sort of pulling their resources together in two workflows to address these issues in working with the local health units, ultimately to help with their experience. So there's a private sector pushing behind this as well that isn't necessarily on, say, Dr. Gardner's lips at the moment, because it is relatively new, but there is lots of support from that side as well.
Certainly. Thanks for mentioning that, Paul. And on the vaccine front, what we saw in the last data, just to give people a glimpse of hope, is the vaccine has made a direct impact in long-term care homes. There was a graph that the doctors had presented, which just showed a decrease in the death rates amongst our long-term care residents because of the vaccine rollout. And so here, luckily, we were one of the top regions, thanks to our public health unit and their team, to vaccinate all of our long-term care homes and senior homes. So we were very much ahead of the rest of the province. So commend the team for doing that.
So Dr. Gardner, if I can ask a question before we go over to bylaw, where Jason will lead off. Can you help people understand, we have provincial orders, but then you have orders, the Section 22 orders that you can use. So can you maybe just talk about what they are and why they're there?
Thank you for that question, Minister Downey. So our enabling legislation is the Health Protection and Promotion Act that dictates parameters for the existence of public health in the province and how it operates. And with it are some powers, including something called a Section 22 order under the Act, which allows a medical officer of health or an associate medical officer of health to require an action in response to what we call a communicable disease, which is one of actually a list of diseases that exist with that act that are contagious and now include COVID-19. And so if we encounter a situation where there is one of these diseases, or COVID-19 to be specific, that they are a threat, a threatening situation of some kind, that an action of some kind is needed and that the order itself is needed to achieve it, i.e. a situation where there is a lack of cooperation potentially, then I have the power to issue such an order, to require an action of some kind. And that can be applied to an individual. It can be applied to a group of people or a class of people. So in the past, we've used these if necessary to manage outbreaks. 99% of the time we haven't needed it, but occasionally it becomes necessary, or to respond to an individual who needs to go into isolation and refuses to do so. And so we can issue an order for that. But we can also do so as a way of setting a standard of practice. So for example, I've done that recently with regards to individuals entering our long-term care facilities and now requiring that they would not do so if they have an individual in their home who has symptoms consistent with COVID-19, while we would await investigations to see if in fact COVID-19 is in that household. So that would be, I think, a specific and tangible example of the use of Section 22.
And thank you for that. And with that, we'll turn to bylaw for some insight into how the front line encounters challenges and what resources you have, and quite frankly, how do you manage that? So I don't know if anybody from bylaw wants to jump in. I'm gonna impose on Jason if I can, and just say, Jason, you're the front line. You get a phone call from somewhere saying there's a house party, or there's a business open, or there's something that you may or may not be. How do you manage that?
Thank you, Attorney General Downey. I do want to preface everything with my comments aren't necessarily for all of the municipalities enforcement. I can certainly speak on how Barrie's been doing it over the last almost year now. We were appointed the lead agency in Barrie. We set up a COVID hotline, email, and phones that was live answered 7 days a week, 12 hours a day from basically March to October. And we were lucky in Barrie where we have a larger staff with a number of officers that work any hours from 7 a.m. till 11 p.m. generally, and 24 hours a day at this time of year. So we were able to respond to a lot of the complaints and stuff in a timely manner. As things changed for businesses during reopening and then lockdowns, et cetera, we had specific officers appointed to handle those complaints and do proactive inspections and reactive complaint inspections, that sort of thing. When a complaint is received, generally we need to see where it falls. If it's something for our office, which generally most of the Act has stuff that we will enforce. When it comes to workplaces, employees, that sort of thing, we generally will forward those on to either the health unit, if it's a health unit concern or a health services concern, or to the Ministry of Labor for health and safety issues within a workplace. We've dealt with all the general complaints that would come forward from the public regarding gatherings or businesses that shouldn't be open, masking complaints, everything that's kind of evolved as this pandemic has evolved. We get a complaint and we will assign an officer and they will go out and investigate and either educate, caution, or enforce as may be necessary. As I said, we've been lucky with the number of staff we have to be able to respond to those in a timely manner and not tie up our police service or the health unit with some of the more generalized complaints.
No, that's helpful. I'll open it to the other bylaw representatives as well, but what types of things do you hear about mostly in terms of calls to your office? What types of inquiries, and has it changed over the last year?
The inquiries kind of change as the legislation has changed. When things first shut down early in the pandemic, it was about the gatherings at people's houses and people not physically distancing when they were outside, businesses operating that shouldn't have been. Then as things changed and people were allowed to gather and be outside, then it was the number of people gathering at these events, drive-through events, with people getting out of their vehicles. And now as things have changed again, it's back to businesses being open, not following rules, people not wearing masks or physically distancing. It's kind of morphed as the legislation and the pandemic has morphed.
Interesting. If I can oppose on some of the others, maybe I'll turn to Brent in the south end of Simcoe, and then maybe to Sean and up in Oro to see if it's the same experience.
Thank you, Minister Downery. And our experience wasn't so different than what Jason described. So in the early days of the shutdowns, we were trying to work with our police colleagues and other agencies to determine who's going to respond to what, and like a triage type setup. So if you're talking about industrial workplaces, where will those go? So if you're talking about parties, and how are we responding to these sort of issues? Our challenge was repurposing our staff, staying flexible, and being able to respond to constantly changing regulations and how to make sense of them. We found that we were fairly successful in engaging residents and businesses at an educational level initially, trying to get the information out to them so they have an understanding, certainly, of what was expected of them. And then as time continued, as we went through and are still going through the pandemic, I guess that focus has shifted a little bit towards enforcement thereof, but also engaging our businesses to get them the proper information that they're looking for.
So I don't know, Sean, in Oro, if you've had similar experience or if it's a little bit different in the rural setting.
Thank you, AG Downey. So for me, being in Aurelia, what we found is that we were inundated with calls and inquiries with respect to the legislation as it continually changed. And those calls have actually gone down quite a bit over the last couple of months. And so I'm interested. I think that likely, business owners have found their other ways to find this information online. And I think the province has done a pretty good job at posting that information so that all can see it, and it's done so in a way that people can understand it. Now, having said that, we've had quite a few inquiries lately, specifically with respect to the capacity limits in the businesses. As you know, the limits, depending on the type of business, can be 50% or 75%. But we've had a number of questions about, well, how do you actually determine what is the calculation to determine that capacity limit? And that isn't in the general information on the provincial website. So you got to dig a little bit further to get that information, and you actually got to go to the provincial regulation. So it's Ontario Regulation 263/20 of the Reopening Ontario Act. So if business owners want to know, okay, how do I determine that calculation? If they go to that specific regulation, there's a section there that clearly sets out how that calculation is done. And certainly for any Aurelia businesses, if they still have questions about that provision or other provisions of the legislation, we're always happy to answer those questions. So you can call our bylaw office and we'd be glad to help.
That's great, thanks. And I apologize, Jordan, that I put Sean in Oro-Medonte. I was thinking John Crawford in my brain. We're working long hours. We're working hard for you, but sometimes that happens. So I don't know, Jordan, if you did want to say something about the more rural experience.
Thank you, Minister Downing. Yes, so I can certainly echo some of the inquiries that we were getting. Looking for clarification on legislation or looking for information on what somebody can or cannot do. So that's kind of, we saw the influx of that near the beginning, and again, it has slowly tapered off. we've also been referring some of those questions as well to the Simcoe, the health unit, as well as the Ontario website. But from the perspective of the more rural setting, we, in the summertime, seeing the beach areas similar to Barrie being, inundated with visitors and people fleeing the larger cities, coming to get some more space. That was primarily our main focus over the summer, was trying to keep some separation and keep numbers a little bit lower in the gatherings. Another aspect would be the rentals, getting, again, individuals fleeing the, compressed city area and coming to a space where they can kind of enjoy and have that space to themselves. So that was primarily more in the summertime. Now looking at ski hills and kind of seeing where that's going to go moving forward.
Thank you for that. And I don't want to leave out Springwater. If Renee or Brittany want to say anything, and then Jim, and then we'll pass over to Minister Mulroney for some other comments.
Thank you. Springwater being rural and smaller municipality, we definitely have, limited resources for enforcement. The beginning of the pandemic, we saw quite a lot of inquiries, like everybody's been saying, from businesses about how they need to operate, when they need to be closed and whatnot. So our focus has been on educating the businesses and educating the residents, providing as much resources as we can. The Simcoe-Muskoka District Health Unit website is a plethora of information, and that's where we see most of our inquiries being guided to. And most of the information that people are seeking can be found on that website. We're also providing resources to businesses, simple things like floor stickers to show social distancing, signs for their doors to show masks are required. So that's been our focus, but we echo the same concerns that the other municipalities have been having, just maybe on a lesser scale.
All right, we'll go over to Minister Mulroney if you would want to make a few comments.
Oh, well, thanks, Doug. I just, we're hearing a lot about how regulations have changed and evolved over time since the beginning of the pandemic. And I just wanted to highlight something that Minister McNaughton, the Minister of Labour, announced just this morning. And actually touches on something that Renee just discussed, which is a lot of small businesses are coming to you for assistance to navigate this. And your efforts have been focused on education. Well, the Ministry of Labour is now coming in to assist with that work. And so Ontario will be sending inspectors to visit small businesses that are going to be reopening this month in order to help boost compliance. And the reason for this is a recognition that a lot of small businesses don't have huge compliance departments that can help them navigate these changing regulations. And so the focus is going to be on education and safety rules, and types of businesses that will be able, that'll be included in this initiative are retail stores, gyms, and personal services in regions that are reopening in gray and red and orange. I believe Simcoe is not included in the first round, but it is something that we are going to start rolling out, and I think it'll help. I hope it'll help small businesses, but it'll also help on the bylaw enforcement side by helping to bolster those education efforts that you're already undertaking.
So, which is a great way. It takes us full circle back to what we were talking about in terms of our constituency offices. The push is for education. If you want to proactively reach out and get some guidance on pieces, we can help navigate that. We may not have all the answers at our fingertips, but as you can see, we're working closely with the public health unit, with the health table centrally, with bylaw on the front end, the Ministry of Labour, trying to solve issues and get answers a little bit at a time. I guess I'm going to, with a few minutes that are left, I'm going to actually, without having told him, turn to Paul Markle and ask him maybe what he's hearing from his members that touch on some of the things that he's just heard.
Thanks, Doug. And again, thank you everybody for coming today. Obviously an important topic. we're hearing very much the same thing. The chamber's in a position where we represent a portion of the business community, certainly not all of them. That's another issue in itself, but we were always accepting new members if we want to go that route. But getting that communication piece out is really our main goal at this time, and that's where our programming has been directed. So working with Andrea's office and your office in the city of Barrie directly, and obviously the number of town halls that we've done with all levels of government have been very effective in getting messaging across. And that what we're hearing really is there's no real issues with a lot of the things that are being done. It's more the communication and misunderstanding of what communication is out there and kind of deciphering where to find that information. So if I had advice for any of the panelists here, would be to think from the end user's perspective in terms of how things are delivered and when they're delivered to avoid confusion. But we take the all open doors perspective on this. So any questions that come in, we redirect where necessary, answer where we can, and hope that we're doing our part to help in getting this under control and moving us out of it. So again, I applaud all of you for all the work that you've done. Government has worked very well together collaboratively. That's commonly recognized. Not everything's perfect. There's lots of gaps still, but working this way is encouraging for the future. So don't take all the negative comments as being a statement of your efforts. It's a very few that I think are thinking that way, and hopefully we'll be done with this soon. Thanks.
Thanks for that, Paul. And maybe I'm just going to go around for a few moments, and then I'll turn it over to Mr. Mulroney and Mr. Dunlop to wrap us up. But let me start with Dr. Gardner, if I can. Where do people go to find information that you are involved in putting out there? And then I'll turn to maybe Andrea. She works on that, and then I'll turn to bylaw, anybody that wants to steer us. So maybe Dr. Gardner first. Where do we find information to stay current?
Certainly, we do all that we can to make it come to people. We do a lot of media work and social media work, and refashion our messages in line with what we hear through social media or through contact from the public. But certainly they can call us. We have a Health Connection line. We have that information on our website. Our website is a good resource, and I do thank those who commended it. We do a lot of work on it. I'd like to commend Dr. Revelado for a tremendous amount of work on it. And on it is a lot of resources for businesses, for the general public, for healthcare practitioners, targeting the needs of all. So call us, email us, look at our website. We reach out to you too, media and otherwise.
And just to build on what Dr. Gardner said, all of us MPPs, we do have websites. So that's one great resource for information. Mine specifically, AndreaMPP.com, simplified it in terms of helpful resources. It's up to date with what red zone means for a region. It has a breakdown, as well as what we have in terms of government. If you ever are watching our the health officials give a briefing and you want that specific data, you can, it's a quick Google, but it's the Ontario Science Table. And the website for that is covid19/sciencetable.ca. That gives you a breakdown of all the all the information they have out there. And of course, we have our Ontario website that's constantly up to date with cases every day. What you can also do on there is you can check your results. You can check testing in your area. You can also go to it for supports, and that's of course covid19.ontario.ca. And in there, you can find different types of supports for you and up-to-date information.
Thanks for that. I don't know who I'll tag first. I know, Jason, you mentioned a resource line. Maybe you can highlight that, please.
Yeah, certainly. Anytime something changes in the legislation, the city of Barrie has been putting out media releases also. And all the information can be found on the city's website at barrie.ca. Enforcement Services did put in a hotline, for lack of a better term, an email system, enforcement.services@barrie.ca, which is monitored 7 days a week, basically, so that we can handle any complaints or concerns as they do come in. Our phone number also at Enforcement Services is live answer Monday to Friday, 8:30 to 4:30. So people can reach out there as well for any questions or concerns. I did want to note that for any of the public out there watching, that we don't get any real lead time on any legislative changes, just like the public. We wait for it to get posted, then we have to read through it quickly and bring our team up to speed. So if somebody, if things are changing and the public call us and we tell them we'll have to get back to them, that's generally why. There's no real lead time for any of our of these agencies. When it gets posted on the provincial website, we learn about it.
So maybe I'm just watching the clock. I know we're right on schedule. I'll turn to Minister Mulroney.
Well, thank you. Thank you very much. I want to thank all of you for taking the time to attend today's town hall. It's really important that we take these opportunities to connect with one another and to stay informed. So I'd like to thank the Barrie Chamber of Commerce, City Bylaw Officers, and the Simcoe Muskoka District Health Unit for joining us and helping further navigate the protocols in our community. I'd also like to thank Doug Downey and his office for spearheading the organization of this event, because together we can support local businesses while also reducing the spread of COVID-19. So please continue to shop local and stay safe.
And over to Jill to wrap us up, please.
Great. Thanks, Doug. Thank you, Caroline. I would like to echo my thanks and appreciation for both the panelists and participants that joined us here today. Within this framework, we will be able to reach over 100 participants and even more through the live stream benefit to those who were unable to register or attend. We as a region recognize that there was a clear need for this importance to holding the town hall. Just as the Chamber has helped to highlight the business supports, we wanted to also discuss the enforcement process. We hope you found value and clarification to some of the questions you may have had, and we encourage you to continue to reach out to your local MPP's office directly for assistance and further guidance when needed. So thank you all for your valuable time today. We look forward to continuing to provide you with the support you need in order to live and work successfully in your community.
And I said that would be the wrap up, but I left Norm over. Norm, you're on the right side of my screen. If you want to say a closing piece, please. Thank you.
Sure. Thanks, Doug, and thanks again for organizing this. Thanks to all the bylaw folks and Dr. Gardner for participating. I think I was especially encouraged to hear the emphasis on education for businesses. That's certainly something I very much believe in. So I'm very pleased to see the bylaw offices using that approach, and as well the Ministry of Labor to first do all they can to help educate businesses before they get fined for something. So really happy to hear that. And again, thanks for organizing, bringing this forum together today.
Great. And with that, thank you everybody for your time. Stay safe and don't hesitate to reach out if you have questions.
Hi, everyone.